Every year, physical therapy school gets more and more expensive. In the last 5 years, tuition rates have increased by $12,000. So, what would it look like by the time that you are ready to apply to PT school? And the most important question, is it worth it to get into physical therapy with rising tuition costs? Hey, what's going on everyone? My name is Dr. Justin Lee, physical therapist. I'm the PT admission expert and I help students get accepted into physical therapy school the first time. So when I was an undergrad, I was thinking about which career choices I wanted to get into. And I decided, hey, you know what? I want to get into physical therapy, but I was really concerned with the tuition of how much I was going to pay and the salary that I was going to make. And I was really torn and I was at a crossroads between should I become a physical therapist or something else in the healthcare related field, should I become a physician assistant? And I really wanted to decide which of the two were really important for me. So in this video, I'm gonna kind of compare these two, but you can definitely use the same concepts for other healthcare professions. But I think physician assistant is the most comparable as far as which healthcare profession to get into. Especially right now in 2023, PT and PA are pretty competitive. Kind of different fields, but pretty relatable as far as which path you should go down. So let's rewind and go back to my undergrad years where there was two trajectories in life. Dr. Justin Lee, physical therapist, or Mr. Justin Lee, physician assistant. When I was back in the day and I was thinking about these two professions, I looked at three main things: the cost of tuition, the growth in salary, and how much school am I going to commit to. So we're gonna look at all of that. So I looked at these three main things because these were things that were able to be measured and pure facts that were just objective. So I was able to compare and contrast using numbers only without any subjective type of matter here, right? So when it comes to the cost of tuition, looking at the data, the official documents, I was able to find accurate data going from 2018 to 2019. It takes time for these numbers to develop, but this was the latest information that I got. So, physical therapy school tuition, the public sector cost $65,000 for all 3 years, and the private sector was $112,000. Now, PA school, the public sector costs $52,000, and the private sector costs $95,000 for the 2 years that you're in there. Now I did find more current data only for the physical therapy world, and in 2020 to 21, the public sector cost $69,000 and private sector cost $118,000. Now I know I mentioned earlier in this video that tuition rates increased by $12,000, but that was within the last 5 years. The numbers that I gave you were in the last 2 years. So really what we're looking at here is not necessarily the trend of what tuition costs are going at, but more of how much tuition actually costs. So if I was in 2018, 2019, I was looking at tuition rates, how much am I going to pay for physical therapy school or physician assistant school? That's the numbers that we're looking at right now. So next we're looking at salary growth. And the data that I was able to get for the salary growth was from 2016 to 2021. In 2016, as a physical therapist, you'd be making $87,000 a year. And as a physician assistant, you'd be making $102,000 a year. Now, this is the average salary that came from the Bureau of Labor Statistics. Now, in 2021, 5 years later, physical therapists made $95,000 a year, making a gain of $8,000 of salary increase. And physician assistant made $120,000 a year, making a gain of $12,000. Now, in this category, what we're looking at is the trend. Not specifically the numbers right now, but I'm concerned, hey, as I'm going into this field, is my salary going to increase? That's going to be important for me because if I'm going to pay a lot for PT school or PA school, I better make sure my salary is increasing. So as you can see from the numbers here, 8K growth, 12K growth, starting at 87,000, starting at 102,000, and constantly growing. Which one has an increased slope or a higher rate of increase in salary? And which one starts off at a higher salary? Yes, you guessed it right. Physician assistant. And lastly, let's talk about the length of school. getting a doctorate of physical therapy degree takes 3 years, and getting a master's of physician assistant takes 2 years. 3 years, 2 years, doctorate, master's. Now, of course, we all want to strive to get that doctorate degree, right? Because it's nice. It's nice to be called Dr. Justin Lee Physical Therapist versus Mr. Justin Lee Physician Assistant, right? So having that title is, yeah, I mean, that's prestigious in itself, but is it worth it? Is it worth it to do a whole nother year for doctorate versus less of a year as physician assistant? And when we looked at the numbers here with the cost of tuition and how much salary that you're gonna make and the growth of that in the last 5 years, is that worth it? So let me share you my opinion. So back when I was in undergrad and I was looking at these numbers, doing the same exact research that I just showed you in this video, I was thinking about, is it worth it to become a physical therapist or a physician assistant? Yeah, physician assistant, you make a lot more money, tuition is less, and you are in school for less of the time, 1 less year, versus a doctor of physical therapist, right? You guys know all the information. So looking at the numbers itself, it makes sense to go the physician assistant route because that just makes more of a financially smart decision to go down that direction. So if you're looking in the perspective of a financial aspect, physician assistant is going to be the way to go compared to physical therapist where you're not setting yourself up for success. Now, if you're opening up your horizons and looking at different perspectives, you have the financial lens, but what about the well-being lens, the long-term impact lens, the philosophy of treatment lens? Let's look at that here for a second. So, well-being, right? Physician assistants typically work in the hospital all the time. Yeah, they have different settings, but they're the most clinical setting where physician assistants work at are in the hospital. Versus physical therapists, the most clinical settings, the most common clinical setting that physical therapists work are at outpatient orthopedic settings. So, did I want to work in a hospital? Yeah, and could I have gone into different routes? But chances are I'm going to land in a hospital. Or did I want to be in an outpatient clinic where I'm not in a hospital, where I'm more in a more casual setting without the bureaucratical things going on in the hospital? And personally, with my personality, being in that outpatient orthopedic setting or outpatient setting was more of who I was versus being in the hospital. And that's what I mean by well-being. Like, what's my identity? Did I want to have a identity moral conflict going into work? I don't want to go into work thinking, oh, I hate being in the hospital. It's so cold in there. There's so many germs, all of those things. I want to go to work thinking, man, I can totally be myself. I could be silly. I can say certain things without worrying about the political aspect of stuff. I can go casually if I wanted to. If I wanted to wear a t-shirt, jeans, whatever. Tattoos, right? All of those things are something that's really important for me. So that was one aspect. Another aspect was the impact that you're going to make. Now, impact for me and for my future career was really important. I wanted to help people, but more specifically, I wanted to make a long-term impact where I felt that I was contributing to one's life to change and alter the trajectory of their health and their overall mortality, right? And yes, physician assistants can definitely do that. Physical therapists can do that too. So now we trickle down into a deeper approach as to how are each careers treating? What's their philosophy of treatment? Because that's gonna alter that's gonna influence the impact that we're gonna make. And physician assistants treat with medicine or surgery or anything the medical related things are giving out for treatment, which is typically medications, injections, pills, and surgery. Physical therapists, on the other hand, don't do that. We don't do medication, pills, injections, or surgery. We're conservative care. We use the body to heal itself. Exercise, stretches, manual therapy, that kind of stuff. And personally for me, I wanted to equip and empower people so that they can help themselves and be independent for the rest of their lives. I did not want to help people by giving them medication and them to rely on that and keep coming back for a refill all the time, or it gets so bad where they're like, hey, you know what, let's go ahead and get you surgery as the next option. That does not empower people. So we're talking about the long-term impact here. Physical therapists were the ones where they teach you how to help yourself forever. They get to a point where people don't have to keep coming back for refills over and over and over again. They teach you exercises and different things to help self-sustain and manage your discomfort, pain, ailments, whatever, so that you can live your life better. Last little aspect of physical therapy is that physical therapists can enhance your quality of life. Physician assistants treat that issue there and they say, all done, bye-bye, I don't see you ever again. And that's the cap, that's the ceiling. There's no more room for growth. Physical therapists, on the other hand, can always enhance performance or function. So let's say, yeah, you got a knee replacement, hip replacement, you can't walk. Physical therapists can help you get to a place where you can start walking. But after that, they can say, you know, if you have goals of, I actually want to start jogging, I want to start doing a marathon, I want to start doing Spartan races, physical therapists can keep helping you elevate your health to go, and get to that point. Yeah, we can finish you off at saying, hey, you know what, we're done with walking, you're discharged, but if you wanted to, we can continue on the growth. Physician assistants, there's a cap, and there's not much more you can do beyond that. So when I was at the crossroads, those are the things that I was thinking at, and ultimately I decided if I'm a physician assistant, I'm going to be miserable and I'm gonna hate going to work every day of my life. But I can totally see myself working as a physical therapist and loving my job and going to work excited to know that I'm gonna make an impact and I could help people and build those relationships and constantly help change the world to become a healthier place through sustainable, long-term change. So I'd love to hear your thoughts. Is it worth it to become a physical therapist despite the rising tuition costs? Or should you look into other options? Maybe another healthcare related field? And if so, which one? I'd love to hear from you. Feel free to comment below your response. Alright y'all, that's it for today. I'll see you in the next video. Have a great one, you guys.